So hello dear students, today we are going to have a discussion on front, lateral and medial side of leg and the dorsum of foot. So before moving on to the chapter, let us see something on tarsal bones. Now you have to know the name of the tarsal bones, you have to know the location of the tarsal bones. Okay. Now coming to the tarsal bones, you can find this is the calcaneus bone. Okay, here comes your calcaneus bone. Then just below that is a talus bone. Then comes navicular and cuboid. Okay, navicular and cuboid. This cuboid comes in the lateral side. This is a little toe, this is a great toe. Okay, so cuboid comes in the lateral side, that is on the side of your little toe. Okay, small toe. Then there are three cuneiforms. Okay, there are three cuneiform bones. They are named medial cuneiform, intermediate cuneiform and lateral cuneiform. So the tarsal bones are calcaneus, then talus, then navicular, then cuboid and three cuneiform bones. So the three cuneiforms are medial, intermediate and lateral cuneiform. Okay, now these are the tarsal bones. Then just like you had got metacarpals and the phalanges in your upper limb, the similar pattern is seen in lower limb also. So here also you have got metatarsals, you have got phalanges. Okay, there are proximal, middle and distal phalanges. Okay, you have to study the name of the tarsal bones. Okay, it can be asked for 3-mark questions. So the name of the tarsal bones from the upper summit, it is calcaneus, then talus, navicular, cuboid, and there are three cuneiform bones: medial cuneiform, intermediate cuneiform and lateral cuneiform. You have to know the location of these tarsal bones, because when we learn the muscles, when the insertion of the muscles, when it is told like it inserts to medial cuneiform, you should know where is the location of medial cuneiform. Okay. Now these are the muscles of front side of the leg. Okay, front part, anterior part or anterior compartment of the leg comprises of these muscles. Now we are going to see each muscle in detail. Now here you should know that the main muscles you can find here are tibialis anterior, then extensor hallucis longus, extensor digitorum longus. Okay, these are the three muscles seen in this picture. Okay, now you have to know that basic thing here is that in case of lower limb, the anterior surface is the one which is termed with extensors. Okay, extensors. Okay, so in the sole or in the sole area you find the muscles which starts with the name flexors. Okay, so you should know this. Anterior compartment, you can find this extensor muscles. Muscles are named with extensor. Okay, in case of sole of foot, in the other part you find the muscles which starts with flexors. Okay, now another thing to note here is there is something known as hallucis. The hallucis term, it refers to great toe. Okay, hallucis longus. Okay, in the upper limb you had something known as pollicis longus. Pollicis is the one or the muscle which goes towards your thumb. Okay, so the muscles in the thumb region are known as pollicis. Okay, flexor pollicis longus, that is a muscle in the upper limb which goes towards the thumb region. Now here the great toe, when it goes to great toe, it is termed as hallucis. Okay, hallucis longus, it refers to a tendon which goes towards your great toe. Okay, now as you know, digitorum, this is the one which gives off 4 slips. Okay, it gives off 4 slips. Okay, here you have to just take note of this one, that is there is something known as retinaculums. Okay, as you have it in the upper limb, the same thing you have in the lower limb also. Okay, you have got retinaculums. Now the major functions of these are they holds our tendons and all in place. Okay, that is a major function you can say. Now there are two extensor retinaculums. There is a superior extensor retinaculum and inferior extensor retinaculums. Okay, this is the superior extensor retinaculum and this Y shape, you can find it as Y shaped. these Y shaped, okay, it is known as inferior extensor retinaculum. Okay. Now superior extensor retinaculum, it is attached towards medially, you can find it is attached towards, this is the medial side, this is the lateral side. Okay. So medially it is attached to the tibia bone and laterally it is attached to the fibula bone. Okay. Now the inferior extensor retinaculum, it is a Y shaped band, or you can say a fascia which is a Y shaped, and the attachment is, it is present in front of the angle joint. Okay, angle joint region. Okay, coming to the muscles of the front of leg or anterior compartment of the leg, the first muscle we are going to discuss is tibialis anterior. Okay, tibialis anterior. From the name itself we know it is a muscle which is located anteriorly. So it is located in the front region of the leg, anterior compartment of the leg. Now, as it is named from tibialis anterior, it takes its origin from the tibia. So, which part of tibia? It takes its origin from the lateral condyle. Okay, it takes its origin from the lateral condyle of tibia. So, we know that there are two condyles for these bones. There is a lateral medial condyle. So, this takes its origin from the tibia and in the lateral condyle of the tibia. Okay, and also from the upper two-third of the shaft of the tibia region. Okay, shaft of tibia, and these tibialis anterior muscle inserts towards the medial cuneiform. Okay, medial cuneiform, and also the base of first metatarsal bone. Okay, base of first metatarsal bone. So, tibialis anterior muscle takes its origin from the lateral condyle of the tibia and also from the shaft of the tibia, and it inserts towards here, that is the medial cuneiform plus the base of the first metatarsal bone, that is on the great toe. Okay, base of first metatarsal bone. So you have to remember like tibialis anterior. Tibialis, so it takes its origin from the tibia part. Okay, now anterior, so it is in the frontmost region, so it is towards the first metatarsal bone, base of first metatarsal bone, and also to medial cuneiform, that is on tibialis anterior. Coming to the next muscle, that is extensor hallucis longus. Okay, extensor hallucis longus, we all know that these muscle inserts towards the base of the distal phalanx of the big toe. It goes till the distal phalanx, that is it goes till the end of this. Okay, these muscle tendon goes till the base of, okay, till the base of distal phalanx or till the end, okay, of the big toe. Now, where does it take its origin? Extensor hallucis longus takes its origin from fibula. You can find it, it takes its origin from fibula bone. Okay, so tibialis anterior is from tibia. The next muscle, extensor hallucis longus, is from fibula. Okay, so it takes its origin from medial surface of shaft of fibula in the middle 2/4 and also from the interosseous membrane. Now, there is something known as interosseous. What does it mean? Interosseous, that is between the bones there is a membrane. So, there is a membrane known as interosseous membrane between a tibia and fibula. So, it takes its origin also from the interosseous membrane and it inserts towards the base of distal phalanx of the big toe. Okay, so this is extensor hallucis from the fibula towards down towards the base of distal phalanx of the big toe. Now let's do the third muscle, extensor digitorum longus. Okay, extensor digitorum longus, it is a combination. Okay, we told tibialis anterior, tibia, extensor hallucis longus, fibula, extensor digitorum longus from tibia plus fibula. Okay, remember like that. So it takes its origin from lateral condyle of tibia plus middle 2/4 of medial surface of shaft of fibula plus interosseous membrane. So from three of the things, tibia, fibula and interosseous membrane. Lateral condyle of tibia middle 2 by 4th of medial surface of shaft of fibula, and then from the interosseous membrane. Now this tendon, as we all can see, divides into 4 tendons to the lateral 4 toes. That is, it divides this is the one which comes, okay, this is the tendon which comes, it comes here, divides into lateral 4, okay, lateral 4 toes. So these 4 toes, okay, it divides into 4 tendons towards the lateral 4 toes, okay. Now this is a picture showing all the muscles. So we have discussed here with 3 muscles, tibialis anterior we have discussed, extensor digitorum longus, and then tendon of extensor hallucis longus, which comes towards the tibial big toe, okay. Now the other muscle which you find here is gastrocnemius, which we have already discussed, the muscle in the back side, okay, which also can be seen anteriorly, that is, you can see it in the posterior part here, okay. Now along with that there are muscles, that is peroneus longus and peroneus brevis, which are seen in the lateral side, okay, lateral side of the leg, okay, they are the muscle present in the lateral side. Now they are termed as peroneus longus and peroneus brevis. Another name is fibularis longus or fibularis brevis, okay, lateral side, so it is termed with fibula. Tibia is the medial bone here, fibula is a lateral bone, okay, just like you have got radius ulna. So fibularis longus and fibularis brevis. Okay, this is the 4th muscle, that is peroneus tertius, okay, peroneus tertius. Peroneus tertius also takes its origin from the shaft of fibula, okay, shaft of fibula. So in short, tibialis anterior, tibia, extensor hallucis longus, fibula, extensor digitorum longus, tibia plus fibula, and the last one, that is peroneus tertius, it is also from fibula, okay. It is from the medial surface of lower 1/4 area of the shaft of fibula and the interosseous membrane, okay. Now it inserts towards the base of 5th metatarsal bone. Now you can remember it based on like this also, these 2 muscles, that is the muscles in the extremities. This is tibialis anterior, this is peroneus tertius. Tibialis anterior from tibia, peroneus tertius from the fibula. This inserts to the base of 1st metatarsal bone, this inserts to the base of 5th metatarsal bone, okay, 5th, that is, this is towards the first one, this is towards the last one, okay. See like this, the first one, the tibialis comes towards the base of here, that is 1st metatarsal bone. Peroneus tertius comes towards the base of 5th metatarsal, that is towards the little finger, okay, base of the 5th metatarsal bone, okay, that is peroneus tertius. So it is only from the lowermost part you can find, lower 1/4 of medial surface of shaft of fibula towards the base of the 5th metatarsal bone. So this is again a picture to show the other muscles, okay. Now this is towards the backside muscle, the bulk of the backside muscle, which is extended towards the sides, okay. Now these are the muscles, tibialis anterior muscle, then there is extensor digitorum longus, okay, this we have discussed. Okay, there is one more muscle, that is a small muscle. Actually this is situated in the lateral part of the dorsum of the foot. This is actually not a muscle which comes in the anterior compartment of the leg, okay. This is a muscle present in the dorsum of the foot, okay, understand this. Extensor digitorum brevis is a muscle which is located in the dorsum, okay. Extensor digitorum brevis is a muscle which is present in the dorsum of the foot. Now this is present deep to the tendon of extensor digitorum longus. We know that extensor digitorum longus muscle has its tendon which inserts towards the lateral 4 toes, okay. Now this muscle you can also find this muscle actually arises from the calcaneus bone. Okay, see the calcaneus bone. From the calcaneus bone, the muscle arises, okay, from the anterior part of superior surface of calcaneum, and these muscle divides into 4 tendons. You can find here 1, 2, sorry. Okay, so these muscle in this is the first one, second tendon, third and the fourth. So these muscle divides into 4 tendons for the medial 4 toes. Okay, this is towards medial 4 toes, these 4, not here, these 4. Okay, medial 4 toes. Okay, and now we have to know that the medial most part, that is the tendon which comes over to the medial part, it is known as extensor. To the big toe it is termed as hallucis, extensor hallucis brevis. Okay, extensor hallucis brevis. The medial most tendon which goes towards the big toe, which is can be separately known as extensor hallucis brevis. Okay, now it is inserted towards the base of the proximal phalanx. So till here you can see it, till here, only till proximal phalanx. Okay, till here there is a tendon of extensor hallucis brevis. Okay, now other 3 tendons you can find, these tendon joins with the tendon of extensor digitorum longus, and these forms dorsal digital expansion. Okay, dorsal digital expansion. Okay, so dorsal digital expansion for the second, third and fourth toes. Okay, so that is the one just like we have in the upper limb. Okay, dorsal digital expansions. You can see the tendon separately here. See, this is extensor digitorum brevis muscle. So separately the first medial most one can be known as extensor hallucis brevis, which inserts only till the proximal phalanx of the big toe, hallucis. So it is towards the big toe, but only till the proximal phalanx. Okay, while our muscle, that is extensor hallucis longus, it inserts till the base of the distal phalanx. Okay, that is a difference. Another one is extensor digitorum brevis. You have the 3 tendons which goes to a second, third and fourth finger, and this along with the tendon of extensor digitorum longus forms dorsal digital expansion. So dorsal digital expansion is for second, third and fourth toes. Okay, so these are the muscles of anterior compartment of leg and dorsum of foot. So in the dorsum of foot we have a muscle known as extensor digitorum brevis and extensor hallucis brevis. So you have to remember that brevis muscles are located in the dorsum. Okay, dorsum of the foot there are brevis muscles. So in short, when you speak about the anterior compartment of the leg comprises of extensor tibialis anterior, extensor hallucis longus, extensor digitorum longus and peroneus tertius. Okay, tibialis anterior, which origins from tibia, goes towards first metatarsal bone base. Extensor hallucis longus, fibula, towards the big toe, hallucis. Extensor digitorum longus from tibia plus fibula and goes as medial 4 tendons. Okay, 4 tendons into the 4 toes, lateral 4 toes. Peroneus tertius, which is the last one, which is from again from fibula, the alternative of this one. Okay, from fibula it is towards the 5th metatarsal. So these two can say extremities. Okay, tibialis anterior, tibia, first metatarsal bone, peroneus tertius, fibula and the 5th metatarsal bone, base of these bones. Okay, now another thing, it's very easy to learn what are the structures coming under. Okay, structures passing under the retinaculum, that is under the superior extensor retinaculum, that is this one. Okay, superior extensor retinaculum and inferior extensor retinaculum. So what are the structures passing under the retinaculum? Okay, coming to the muscles, these four muscles, that is tibialis anterior, extensor hallucis longus, extensor digitorum longus and peroneus tertius. Now what are the vessels coming here? The vessels coming here are, you can find here anterior tibial artery and deep peroneal nerve. Anterior tibial artery and deep peroneal nerve. So these are the six structures present in the retinaculum. Okay, four muscles plus two vessels, an artery and a nerve. Okay, now when you say it in the order, you can find first is tibialis anterior, second is extensor hallucis longus, third one is anterior tibial artery, fourth one is deep peroneal nerve, fifth one is extensor digitorum longus and sixth one is peroneus tertius. See, these are the structures passing under the retinaculum. Four muscles plus two vessels, that is anterior tibial artery and deep peroneal nerve. Okay. Now here you have to know there is something known as anterior tibial compartment syndrome. Anterior tibial compartment syndrome. It is also known as Fresher's syndrome. Fresher's syndrome. Now this syndrome is nothing but because of too much exercises. Okay, because of too much of exercise, too much of stress to this area, there can be pain in these muscles. Okay, the anterior compartment muscle experiences pain because of too much of exercise, and when you touch this muscle there will be severe pain. So this is known as anterior tibial compartment syndrome or Fresher's syndrome. It is a syndrome which affects the anterior compartment muscles. The muscles will have pain and there is tenderness. This happens because of when there is too much of sudden exercise. Okay. So this is again another picture to show the retinaculums. Okay, to show the vessels under this. I have already discussed this. So this is a picture showing the muscles and the tendon of the muscles along with the vessels. Okay, now here in this picture you can make out the extensor digitorum brevis muscle and also extensor towards the great toe there will be extensor hallucis brevis. So in the dorsum of the foot the muscle present are sorry, extensor digitorum brevis and extensor hallucis brevis. Now let's see into the vessels present in this region. Okay, what are the vessels present here? We can find here, let us see with the origin of the arteries. Okay, we have the abdominal aorta which divides or which forms common iliac artery. This common iliac artery divides into external iliac, internal iliac, both the sides. There is the shorter one is internal iliac, the bigger one is external iliac artery. Okay, now the external iliac artery continues as femoral artery. Okay, femoral artery. This femoral artery continues as popliteal artery. Now this popliteal artery divides into main divisions. Okay, anterior tibial artery and posterior tibial artery. Anterior tibial artery and posterior tibial artery. This anterior tibial artery, it continues as dorsalis pedis artery and it forms an arch. Okay, so you have to know that femoral artery continues as popliteal artery, which divides into two main divisions are anterior tibial and posterior tibial. Now anterior tibial, it forms dorsalis pedis and dorsalis pedis forms plantar arch. Okay, so whenever there is an artery being asked, you have to mention about the origin of the artery. Okay, from where do these artery arises, branch of which artery. Okay, now here you may get a question on dorsalis pedis artery can be asked. So dorsalis pedis artery, you can say it is a continuation, it is a continuation branch of your anterior tibial artery. It continues as dorsalis pedis artery. Okay, now anterior tibial artery, this is again a picture to show the arterial and the venous one. Concentrate on the arterial one, common iliac which divides into internal iliac and external iliac. Internal iliac is a smaller terminal branch, external iliac is a larger branch. It continues as femoral artery as popliteal artery, popliteal artery as anterior tibial, and posteriorly it goes as posterior tibial, and the anterior tibial as it reaches the foot it is known as dorsalis pedis artery. This is the main branches or main subdivisions we can say. Now let us learn about anterior tibial artery. Okay, it is a main artery. It supplies the anterior compartment of the leg. Okay, and as we all know, it is a branch of popliteal artery. It is a smaller terminal branch of popliteal artery. Popliteal artery gives of many other branches which we have already discussed. Main terminal branches are anterior tibial and posterior tibial. Now anterior tibial, as we know, popliteal artery is present posteriorly. Okay, popliteal artery is present posteriorly. So actually the artery is present posteriorly. Now popliteal artery, this anterior tibial artery actually begins in the back side of the leg itself. In the back side of the leg there is a muscle known as popliteus, that is in the bend of the knee. This is the posterior side. Okay, so in the bend of the knee there is a muscle known as popliteus. Okay, so these anterior tibial artery begins on the back of the leg region, lower border of the popliteus. Okay, and it enters into the anterior compartment. This is present posteriorly. It enters. How does it comes in front? Okay, so it enters the anterior compartment. There is an opening in the interosseous membrane. So there we told there is an interosseous membrane between the two bones. So it between the interosseous membrane it pierces there. It goes into anteriorly. Thus it comes anteriorly. Okay. Now in the anterior compartment it runs down between the two malleolus. Okay. Now where is malleolus? That is in the angled region. You can find. Just check your angled region. You can find two bony prominences in two sides. So they are known as malleolus. Okay, malleolus. So just check your angle. Near to angle there are two bony prominence. One in the medial side, one in the lateral side. Medial side is known as medial malleolus. The other one is known as lateral malleolus. So these anterior tibial artery, it runs downwards between the two malleolus. Okay, then at this point it becomes dorsalis pedis artery. Okay, dorsalis pedis artery. Now let us see the course of this. You can find in this picture itself. Initially the anterior tibial passes between, you can see here, okay, the upper 1/3 of the leg. It passes between two muscles. They are tibialis anterior and extensor digitorum longus. Okay, so initially the artery is present between tibialis anterior and extensor digitorum longus. As it goes down in the middle section, that is here in the middle section, it passes between tibialis anterior and extensor hallucis longus. So see the picture and learn this. So initially it is between the upper part, it is between these two muscles, that is tibialis anterior muscle and extensor digitorum longus muscle. As it goes in the middle, there are two muscles here, tibialis anterior and extensor hallucis longus. So initially between these two muscles and then between tibialis anterior and extensor hallucis longus muscle. Okay. Now as it goes down, you can find in the lower part it runs between these two. Okay, these two muscles, that is extensor digitorum longus and extensor hallucis longus. Okay. Now these artery, as it goes between the two malleoli, then it becomes dorsalis pedis artery. Okay. So this is the course and relation of the artery. Anterior tibial artery originates from the popliteal artery. At the level of popliteus, it begins, enters anteriorly, interosseous membrane. Now in the anterior compartment, it lies initially between tibialis anterior and extensor digitorum longus, then between tibialis anterior and extensor hallucis longus, then between extensor digitorum longus and extensor hallucis longus, and then in the between the two malleolus, in the midway between there, it changed its name towards dorsalis pedis artery. Okay. You have to just go through the branches. Okay, the branches are muscular branches. There are branches being given to the knee as well as towards the ankle. There are lateral malleolar network and medial malleolar networks. Okay, that is on anterior tibial artery. Let us see on dorsalis pedis artery together along with this. In case of dorsalis pedis artery, as we have told, dorsalis pedis, from the name itself we have, it is an artery present in the dorsum, okay. So it begins in the dorsum of the foot, okay. Now this artery is a continuation of the, yes, anterior tibial artery, okay. Now this artery begins between two malleolus, okay, between the medial malleolus and the lateral malleolus, two malleolus. It runs along the medial side, okay, it runs along the medial side of the dorsum, and it reaches the first intermetatarsal space, okay, that is between the first, here this is the first, okay, intermetatarsal space, okay. So proximal end, so towards here, proximal end of the first metatarsal space, then it dips or it comes between the head of the dorsal interossei muscles, which are about to discuss. So here are muscles known as dorsal interossei muscles, okay, and then it forms a plantar arch, okay. Now what are the branches from these dorsalis pedis artery, okay. You can see here, this is the dorsalis pedis, this is posterior tibial artery, this is the other one of branch of popliteal artery. Anterior tibial artery, it comes here. There is a space between first metatarsal, second metatarsal, which is known as intermetatarsal space. So between the intermetatarsal space, it winds around, forms plantar arch, okay. Now what are the branches of dorsalis pedis artery? One of the branch here you can find is arcuate branch or arcuate artery, okay, arcuate artery. So one is arcuate artery. Now this arcuate, as it divides into arcuate artery, it then gives off three branches, that is second, third and fourth dorsal metatarsal artery, dorsal metatarsal, second, third and fourth, okay, second, third and fourth, that is from arcuate artery. Why? You may be thinking about first dorsal metatarsal artery. So first dorsal metatarsal artery arises directly from the dorsalis pedis artery, okay. So one of the branch of dorsalis pedis is arcuate artery. Second branch is, one of the other branches, first dorsal metatarsal artery. Now there are second, third and fourth dorsal metatarsal arteries, which are branches from the arcuate artery, okay. Now apart from that, there are two more branches, medial tarsal artery and lateral tarsal artery, okay, medial tarsal artery and lateral tarsal artery. Now this is the dorsalis pedis artery. As it comes, you can find medial tarsal artery and lateral tarsal artery. Then it gives a first dorsal metatarsal artery. Now there is an arcuate artery. The arcuate artery gives off second, third and fourth dorsal metatarsal arteries, okay. Ultimately dorsalis pedis artery forms a arch, okay. So that is on the branches of dorsalis pedis artery. It's very important, you have to learn this, okay. So first point, dorsalis pedis artery, branch of, or it's a continuation of anterior tibial artery, okay. Now how does it course? It winds around between the two malleoli, runs downwards, and at the point of first intermetatarsal space, it winds around and forms a plantar arch, okay. Now third one, what are the branches? Branches are lateral tarsal artery, medial tarsal artery, arcuate artery, first dorsal metatarsal artery. Arcuate artery in turn divides into second, third and fourth metatarsal arteries, okay. Then you have to write about the relations also. Relations you can see superficial relations, deep, medial relation, lateral relations, okay. Now what are the tendons coming that forms medial and lateral relation? The tendons which comes medially is, the tendon which comes medially is your, which one? Extensor hallucis longus. Laterally is the which goes to the lateral four toes, that is extensor digitorum longus. So that is medial and lateral relations, okay. Medially extensor hallucis longus, laterally extensor digitorum longus, okay. And superficially and deep structures are your, superficially mainly comes your skin, fascias, then the retinaculums comes over here, okay. And deep structures are the bones which comes over here are the deep structures. So this are the other retinaculums, that is retinaculums are also present. Sorry, one more thing to say here is on pulsation of dorsalis pedis artery. Pulsations of dorsalis, where do you feel the pulsations? This is very very important. Pulsation is felt between the tendon of these two, extensor hallucis longus and extensor digitorum longus. So you have to specify between the tendon of extensor hallucis longus and the first tendon of extensor digitorum longus. Okay, it's felt between tendon of extensor digitorum longus, first tendon of extensor digitorum longus and tendon of extensor hallucis longus. Okay, now you might have heard of peripheral pulses. Okay, peripheral pulses. Okay, the one is radial pulse. Apart from that, there is something known as peripheral pulses. Okay, so one of the peripheral pulse which you take for is from the dorsalis pedis artery. So when you write about dorsalis pedis artery, you have to write in applied anatomy about pulsation of dorsalis pedis artery. Okay, pulsation of dorsalis pedis artery. Okay, let's move on to the next one, that is on peroneal retinaculum. We have got retinaculums that they are nothing but thick band of deep fascias. Okay, now there are retinaculums present in order to hold the tendon in place. So in case of coming to the lateral compartment of the leg region, it also consists of retinaculums. Now they are termed as peroneal retinaculum. Okay, peroneal, that is a term. Okay, peroneal retinaculums. So there are superior peroneal retinaculum and inferior peroneal retinaculums. Okay, now superior peroneal retinaculum, they are situated behind the lateral malleolus. Okay, this is towards the lateral malleolus. Okay, now the main function of the retinaculums are they hold the peroneal tendons in place. Okay, that is the main function. There is another thing known as inferior peroneal retinaculum. So that is present towards the anterior inferiorly, that is towards the lowermost portion of the lateral malleolus. Okay, you just have to see the attachments of these retinaculums. Okay, where do they attach us to? The major function of these retinaculums are to hold the tendons in place. Now, what are the muscles present in the lateral side of the leg? The lateral side muscles, obviously we know that the retinaculums are named peroneal. So the muscles are also termed as peroneus. Okay, so peroneus longus and peroneus brevis. You should never confuse it with peroneus tertius. Peroneus tertius is present, it's a muscle of anterior compartment. Okay, now peroneus longus and peroneus brevis forms the peroneal muscles in the lateral side of the leg. Okay, you have to see the attachment of these muscles also. So this is again a picture to show the retinaculums. See the retinaculums and the tendon. You can find the two tendons. The two tendons which you find here is peroneus longus and peroneus brevis. Now you can find here peroneus longus and peroneus brevis muscle. Okay, it both takes its origin. These are the muscle present in the lateral side. So obviously it takes its origin from the bone, that is fibula. We have also seen peroneus tertius also, which takes its origin from fibula. Now peroneus longus, it is a muscle which is present superficially, that is the first muscle which you see is peroneus longus. Just behind that, deep to that, you find peroneus brevis muscle. Peroneus longus muscle, it is situated in the head of the fibula region and also from the middle 1/3 shaft of fibula, and this tendon passes deep to the retinaculum, that is peroneal retinaculum, and this is inserted to peroneus longus is inserted to the base of first metatarsal bone. Okay, first metatarsal bone, and also towards adjoining part of medial cuneiform bone. Okay, lateral side, this is towards the lateral side of base of first metatarsal bone and also towards the medial cuneiform bone. Okay, lateral side, that is the peroneus longus muscle. Peroneus brevis muscle also takes its origin from the middle 1/3 and also lower 1/3 of the shaft of the fibula, and it inserts towards lateral side of base of fifth metatarsal bone. So peroneus longus, it is to the peroneus longus is to the first metatarsal bone. Peroneus brevis is towards the lateral side of base of fifth metatarsal. So this both towards the lateral side, okay, towards the lateral side. Okay, so this tendon lies laterally. Now this is again another picture in order to show the tendon of the muscles. See the tendon here, brevis and longus muscle. Brevis muscle lies deeper to the longus muscle. They both inserts towards, one is towards the base of first metatarsal. That is, you have to know here that the peroneus longus muscle, it goes underneath and goes towards the first, okay, till here. The other one lies till here, brevis lies till here. Okay, see this picture, it is clear. Okay, this is peroneus. It is also termed as fibularis, as it is in the lateral side. Okay, fibularis longus, fibularis brevis, or peroneus longus, peroneus brevis. Peroneus brevis inserts towards here fifth metatarsal bone base. Okay, lateral side. What about peroneus longus muscle? Okay, peroneus longus, as we have told, it inserts towards the base of the first metatarsal bone. Okay, lateral side base of first metatarsal bone. That is peroneus longus muscle. Now you have to understand that as it comes towards the back side and in the sole, it inserts towards this side. See, this is the first metatarsal. Now this is peroneus longus tendon. Okay, peroneus longus. As it goes towards the sole region, there are muscles present in the sole. So there are 4 layers of muscles in the sole. There are first layer of muscles, second layer, third layer, fourth layer. In the fourth layer, there comes peroneus longus. Okay, tendon of peroneus longus comes in the fourth layer of sole. You have to remember this. Okay, fourth layer of sole contain tendon of peroneus longus muscle. Okay, you can see here, no, as it comes towards the back side. Now another thing is, one more thing to speak here is on the action of these muscles. Okay, that is, these muscles, that is your lateral side muscle, they are mainly meant for everter. They are known as everters. Okay, this is eversion. This is how you do eversion. Okay, this is inversion. Okay, this is like you are placing the foot in the ground, this region, elevating this. Okay, that is eversion. The other opposite movement is inversion. Okay, so this is eversion. So everters of foot. So the peroneal muscles are termed as everters. They are everters of foot. Okay, everters of foot. Now these muscles also maintain arches. We have seen on arches of foot. So these peroneus longus muscle, it maintains a lateral longitudinal arch as well as transverse arch. Okay, lateral longitudinal arch and transverse arch of the foot. Okay, that is also very important. Inversion and eversion. So these are the movements. Eversion is done by lateral side muscles. Okay, there is one more movement, that is anterior compartment muscles. They are mainly concerned with dorsiflexion. This is how you do dorsiflexion. Okay, so anterior compartment muscles are responsible for their dorsiflexors of foot. Okay, remember this. Anterior compartment muscle, that is tibialis anterior, all the anterior compartment muscles, they are dorsiflexors of foot. Lateral side, they are mainly everters of foot. Everters. Okay, another thing to learn here is on the nerve supply. Okay, we have told that anterior compartment, there is anterior tibial artery. We have discussed on anterior tibial artery and dorsalis pedis artery. Now we are going to discuss on the nerve supply over here. Now the nerve supply over here, it is mainly by, we have got something known as peroneal nerves. Okay, for this you should understand that sciatic nerve is divided into tibial nerve and common peroneal nerve. Now these common peroneal nerve again divides into superficial peroneal nerve and deep peroneal nerve. Okay, now we have to understand here, deep peroneal nerve supplies anterior compartment. Okay, deep peroneal nerve supplies anterior compartment of the leg, and superficial peroneal nerve supplies the lateral side. Okay, lateral compartment of the leg. Okay. Now deep peroneal nerve, as you all know, it is a main nerve which supplies anterior compartment. It is a branch of common peroneal nerve. Now you have to know the root value of this one, that is root value of deep peroneal nerve. Deep peroneal nerve, the root value is L4, L5, S1 and S2. L4, L5, S1 and S2. Okay. Now these deep peroneal nerve, this is a picture you can find seeing the common peroneal nerve and divisions of common peroneal nerve. Now this is again another picture to show deep peroneal nerve. Okay, you can see that it enters and this is a smaller branch of common peroneal nerve. Okay, now this enters into the anterior compartment, piercing an intermuscular septum. There is an intermuscular, between the muscles there are a thin layer known as intermuscular septum. So it pierces intermuscular septum, extensor digitorum, it pierces extensor digitorum longus. Okay, and then along with the, see, this can be seen together, anterior tibial artery and deep peroneal nerve. Okay, it runs close with that of anterior tibial artery. Okay, now these divides into medial and lateral branches. The deep peroneal nerve divides into medial and lateral terminal branches. Okay, now you have to learn on the branches. Coming to the branches of deep peroneal nerve, there is muscular branches which supplies to the muscles of the anterior compartment, that is to tibialis anterior, extensor digitorum longus, extensor hallucis longus and peroneus tertius, and also a branch to extensor digitorum brevis muscle which is present in the dorsum of the foot. And also there is a cutaneous branch. It mainly supplies the first and second toes. Okay, first and second toes are supplied by cutaneous branch of deep peroneal nerve. Okay, there are articular branches which gives towards the joints. Okay, now what about superficial peroneal nerve? Superficial peroneal nerve supplies, this is a picture of superficial peroneal nerve, it supplies your peroneus longus and peroneus brevis. Okay, so peroneus brevis and peroneus longus are supplied by superficial peroneal nerve. Okay, now to speak about superficial peroneal nerve, it is a main artery which supplies the lateral compartment, first point. Second point, it is a branch of common peroneal nerve. Okay, it is a branch of common peroneal nerve. The root value is L5 and S1. L5 and S1. Okay, L5 and S1. It is a smaller branch compared to the deep peroneal nerve. Okay, now this nerve we can find, it mainly starts in the lateral side. So it is side, it starts at the neck of the fibular region. Okay, and then it goes downwards, it supplies the cutaneous, it becomes cutaneous towards the supply to the distal half. Okay, now you have to know here that another important thing to note here is something known as your there is a clinical condition here which we will discuss. Okay, that is on foot drop. Okay, foot drop. So that is on the superficial peroneal nerve. Okay, now we have to learn that superficial peroneal nerve, it supplies a peroneus longus, peroneus brevis muscle. So when it comes to the relations of the superficial peroneal nerve, it is situated on the lateral side, neck of the fibular region. It is present beneath the peroneus longus muscle. Then it goes towards the peroneus longus. It goes between the peroneus longus and peroneus brevis, and ultimately it reaches towards between the peroneus brevis as well as extensor digitorum longus. Okay, so the course is between the peroneus muscles. Okay, that is what you have to know. Superficial peroneal nerve, the course is between the peroneus muscles and it descends down. Okay, now this also gives of muscular branches, cutaneous branches, communicating branches, medial branches and lateral branches. Okay, so you have to go through the branches. I am not going to discuss in detail on this, just make a reading on the branches. Okay, now there is syndrome known as lateral compartment syndrome. We have learned on anterior compartment syndrome. There is something known as lateral compartment syndrome. Now, lateral compartment syndrome happens whenever there is an involvement of superficial peroneal nerve. Okay, we know that it is a nerve which supplies the peroneal muscles, then later divides into medial and lateral cutaneous branches. Okay, medial and lateral cutaneous branches. Okay, so whenever there is an entrapment or whenever there is a problem with the superficial peroneal nerve, it can cause lateral compartment syndrome. Okay, so it also involved in lateral compartment syndrome. Now that is on superficial peroneal nerve. Okay, superficial peroneal nerve. Now we shall discuss something on foot drop. Okay, now what is foot drop? Whenever there is a deep peroneal nerve injury, okay, whenever there is a deep peroneal, we know that deep peroneal nerve supplies the anterior compartment muscle. Now whenever there is, it's very important, foot drop. Okay, whenever there is a problem with the deep peroneal nerve which supplies your anterior compartment muscle, we know that anterior compartment muscles helps in dorsiflexion to bring it up. Okay, dorsiflexion movements. Now whenever there is a injury to deep peroneal nerve, the dorsiflexion is not possible, the foot drops down. Okay, the upward movement is not possible, it drops down, and that is known as foot drop. So foot drop happens because of a problem or injury to the deep peroneal nerve, because this deep peroneal nerve supplies the anterior compartment muscles, and this anterior compartment muscle helps in dorsiflexion. So whenever there is a problem with deep peroneal nerve, it causes foot drop. Very important. Foot drop happens because of injury to deep peroneal nerve. Now this is another picture showing the common peroneal nerve and deep peroneal. This is deep peroneal nerve, this is superficial peroneal nerve. Okay, common peroneal nerve divides into superficial and deep peroneal nerves. Deep peroneal nerve supplying the anterior compartment muscles, superficial nerve supplying the lateral compartment and the cutaneous supply. Okay, deep peroneal nerve, we have to know this, deep peroneal nerve supply only the first and second. Okay, the rest is supplied by superficial peroneal nerve. Okay, now there is one more thing to discuss here, the last one, that is known as pes anserine bursitis. Pes anserine bursitis. Okay, what is pes anserine bursitis? We have already discussed that GST muscles, no, gracilis, sartorius and semitendinosus. Okay, so there is a bursa present at the insertion of gracilis, sartorius and semitendinosus muscle. Now this bursa can get inflamed and it is known as anserina bursitis. Pes anserine bursitis, this term, or it is known as anserina bursitis. Okay, anserina bursitis, it is nothing but bursitis or inflammation of bursa which is located between the insertion of sartorius, gracilis and semitendinosus. Okay, GST tendon, there is a bursa over there, inflammation is known as pes anserine bursitis. That is very important, you can get a short note. Okay, so in this area the questions can be, nerves can be asked. Okay, anterior tibial artery can be asked, dorsalis pedis, which is the more important is dorsalis pedis artery, then anserine bursitis. Okay, pes anserine bursitis or anserina bursitis can be asked. Now the another one is any of the arteries or vessels can be asked, like anterior tibial artery or common peroneal nerve or superficial peroneal nerve, deep peroneal nerve, foot drop. Okay, sometimes any of the muscle can also be asked. It's not frequently, but any of the muscle can be asked. So you have to go through the anterior compartment of leg muscles, lateral compartment of leg. Okay, so we discussed with this chapter the clinical anatomy also. So that is all on the chapter, that is front, lateral and medial side of leg and dorsum of foot. Thank you.